And as of today, we have 45,899 total positive cases here in Wisconsin, which is an increase of 1,052 cases over yesterday. We are now at 878 deaths in the state of Wisconsin, which is an increase of 13 over yesterday. These numbers are at least in part a reflection of two patterns: a significant number of cases that reported attending gatherings like parties and bars and barbecues, and an increase in cases among young people. In fact, in all confirmed cases within the past month here in Wisconsin, fully 1/3 of them have been people in their 20s. Please, the safest thing to do, as the governor said, is to stay at home, limit your interactions, and wear a mask or cloth face covering when you go out. I know it can be difficult to hear these numbers. We know that each case is a person struggling with the stress of this diagnosis and what that means for their family and their health. We know that each of our 878 deaths is a person who is being remembered and missed by family and friends who feel the heavy weight of their loss. And we know that each of us is dealing with different stressors connected to this pandemic: health and financial concerns, worries related to juggling kids while working remotely, or by virtue of being an essential or public-facing employee, anxieties about the risk of coming into contact with someone with COVID-19. These stressors can certainly compound each other, and no one is immune to the stress and anxiety this epidemic has brought. The increase in calls to 211 Wisconsin asking for help with behavioral health concerns tells us that people are struggling. In fact, the need for assistance with mental health and addiction issues rank third among the reasons for calling 211, behind only COVID-19 and housing concerns. And since the start of the pandemic, we've seen an increase in suspected opioid overdoses by 117% from the same time frame last year. We need you to know that help is available and that it's okay to ask. Calling 211 is one of the ways to connect with sources of support. And the Wisconsin Addiction Recovery Hotline, which you can access through 211, is now available to make follow-up with callers to make sure that they have made the connections necessary to get the services they need. DHS is grateful to be able to provide funding to enable this follow-up program.